I'm pleased to be joined today on Health Beat by Dr. David Keleny, a general surgeon with Faith Regional Physicians Services General Surgery in Norfolk. And we're talking about thyroid surgery. So, Dr. Keleny, tell us about some reasons a patient may need thyroid surgery, how that procedure is performed, and what the recovery process would be.
First, I'll start off with what the thyroid gland is. So it's a little gland that sits in your neck, just under the Adam's apple, and it controls metabolism in your body and energy levels and tries to balance it the best it can. So as you can imagine, this thing can go a little bit out of whack. It can be a little high or it can be a little low. And that brings me into the first one, which is a pretty common indication to remove it, and that's an overactive thyroid gland. And when the thyroid is overactive, it can cause various symptoms, feeling hotter, sweating, that kind of thing. It can be controlled with medication, but once those medications stop working, then that can be an indication to remove it. Another common indication is these things called thyroid nodules. So if you're ever in the bathroom in the morning, you notice a lump in your neck, or your primary care doctor maybe notices something, then that would be worked up and potentially biopsied to see what it is. And if it's something that would warrant your thyroid gland to be removed, you move ahead with that.
When this presents itself, is it diet related at all?
Typically, it's not diet related, no. If it's a nodule, it's usually just picked up on a physical exam. And if it's an overactive or underactive thyroid gland, it's just noticed by its symptoms.
Okay.
And the way we remove these is we make a little incision on the neck, right over the thyroid gland, right in the middle. We detach the thyroid from its surrounding tissues. We remove it through that incision. And after that, you'll spend a night or a day at the hospital recovering, getting everything back to normal, drinking, walking, all that stuff. And then you'd go home and you'd maintain contact with your surgeon and make sure the incision is healing nicely. And also with your endocrinologist to make sure your hormones are at a good level too.
Sure.
Yeah.
Now, this same for a man, same for a woman?
Same, exactly.
Okay.
And removing the thyroid, you can do that because the hormone that the thyroid produces can be given to you as an oral pill. Very
easy.
Yes.
Okay. Well, that's terrific information for our viewers, and we appreciate you being here to talk about it.
Absolutely. Thank you.
And that's Health Beat, brought to you today by Faith Regional Physicians Services.